minimal intervention dentistry is the future of dentistry. And all of you have to believe in this concept of minimal intervention dentistry. And as I explained to you at the end of the lecture, I'll ask all of you whether you believe in minimal intervention dentistry or not. I hope you know me. My name is Dr. Rafi. I'm a professor in pedodontics. And this is the first course in pedodontics. So I have to welcome you to the first pedodontic course. And we have 3 pedodontic courses in total. So what I'll be teaching you today is what is minimal intervention dentistry, aims and objectives of minimal intervention dentistry, principles of minimal intervention dentistry, minimal intervention dentistry techniques, and then we'll conclude the lecture. So look at these pictures. So I want to show you some pictures first. And if you're in the class, I would have told you to check this X-ray. Check this X-ray. And what do you see here? You see proximal caries here. The occlusal side, there is no caries on the occlusal surface, and there is caries only in the proximal surfaces, what we call proximal caries. And even here, you will see there is pit caries or there is fissure caries, but rest of the enamel, rest of the dentine is caries free. You can see these vast areas are caries free, and the caries is only in these areas. Or here you can see only in a pit you can see some caries. But the problem is because we want to restore the tooth, and we are using amalgam, so we make cavities which you can see. For example, for this proximal caries, we make a class 2 cavity, and look at the size of the cavity. You can see we have even involved areas. We have even involved areas where there was no caries, and see, look at something, a lesion like this, and this is the type of cavity we make, isn't it? So we are removing healthy tissue, and then when we do a restoration, it's even bigger. Say, for example, it may be something, a lesion like this, and this is the restoration. See the discrepancy, see the difference. See the difference even here, even here. And then these cavities have a problem. These cavities usually, sometimes they fracture or there is leakage. You can see here, see leakage. And when we do the cavity again, it becomes even. Yeah, I'm pointer. You can see it now. I'm trying to move the pointer here. Because she's saying I cannot see the pointer. I'm trying to use the pointer. Yeah, I'm using it. Okay. Okay. Yeah. Yeah. Can you see it now? Yeah. Can you see it now? The pointer? Yes. Now good. So see here, I showed you proximal caries. I showed you pit caries. I showed you fissure caries. And then I said, see, look at the size of the cavities. The cavity size is much bigger than the lesion. And the restoration size is even bigger than the cavity we have made. And then these cavities have leakages. These restorations have leakages. They get fractured. And look at what we started with and look what happens later. We are removing healthy tissue. We are removing healthy enamel. We are removing healthy dentine to restore teeth. Is this right? No, this is not right at all. We are removing healthy tissue to treat diseased tissue. The size of the lesion here, class 2, proximal caries, is very small, but the size of the cavity very large. The size of the restoration, class 2 restoration, extremely large. So this is something which is unacceptable, and all of you will agree it is unacceptable. We shouldn't be doing this. You see, for example, we have an abscess on a body, or say on our thumb. We don't cut the thumb. We don't remove healthy tissue. We just remove the diseased tissue. And here, this is wrong. The cavity size, the restoration size is much larger than the lesion. Do you agree or not that this is wrong? Answer here, please. You can answer in the chat whether this is right or wrong. Isn't it? This is extremely wrong. Yes. Yeah, this is wrong. We cannot accept this in the modern world, modern dentistry, contemporary dentistry. This is totally unacceptable. We cannot remove healthy tissue, and more healthy tissue than diseased tissue. So this creates a problem, and this is the problem we are going to solve today to see how this can be avoided. Now, that is why we have something called as minimal intervention dentistry. It's also called as minimal invasive treatment or minimal invasive dentistry or microdentistry. Why? Because this is ultra conservative treatment of what? Infected and affected oral tissues. And in this, you know what we do? We preserve maximum amount of oral tissue. We have least invasive intervention, which is painless and atraumatic. See, for example, we have a lesion here, we have caries here, and see the size of the cavity. See the size of the cavity. This is the cavity, and this is the lesion. You can see that the size of the cavity, here we are making the cavity, is extremely conservative. And this is the restoration later, tooth-colored restoration. See the size of the lesion and size of the cavity. This is what we require, not what we saw earlier, where the size of the cavity was extremely large and the size of the restoration was even larger. So when we say minimal intervention dentistry, we mean conservative cavities. Even class 2, very conservative. Even, dovetails and all, very conservative. See, very small. Otherwise, usually this is what you do in amalgam. You make a large cavity with a box and a dovetail, and we involve healthy tissue. No, we don't want to do that. We want to create cavities which are extremely conservative, which are extremely small, and the restoration also, extremely small restorations. This is minimal intervention dentistry, and I'll show you how we do it. We also include what is called as camera. We try to treat caries based on risk assessment. We do a risk assessment of patient. What is the level of risk of a patient to get caries? And we remove those risk factors even before caries has occurred. So once we remove the risk factors, we don't get caries. Just by removing the risk factors, we don't even do a restoration. We remove the risk factors. So that is also what I am going to teach you today. How do we assess for risk, and how do we remove the risk so that we do not have to create cavities, we don't have to make huge restorations. So this is ultra conservative dentistry, also called as minimal invasive dentistry or microdentistry, where no healthy tissue or minimal healthy tissue is removed. As I showed you the earlier slide, there's a vast difference between MID cavities and cavities which are traditional cavities. So what are the aims and objectives of minimal intervention dentistry? What are the aims and objectives? The first aim is that the disease should be treated first. The disease has to be treated first. So what does that mean? Say, for example, somebody has diabetes. And because of diabetes, he has pain in the foot. Because of diabetes, he has some problems with his kidneys. So what do we treat? Do we treat the kidney, or do we treat the disease, diabetes? We treat the diabetes. Because if you treat the diabetes, the kidneys, the skin, the feet, the heart, the blood pressure, everything will be controlled. But if you start treating the signs and symptoms of the disease, no, you will not be able to treat the disease. Similarly, we have to treat, say, for example, we have to treat dental caries. Yes, you will be doing a restoration in a tooth, but that is not the treatment of caries. That is the treatment of the lesion which was created by caries. You have to stop dental caries. This is number one. Treat the disease first. Number two, surgical approach. Any surgical approach should be the last resort. The last option should be surgery. Any type of surgery, any type of intervention should be the last step. And you should remove the least amount of natural tooth material. This is the aims and objectives of MID. MID means minimal intervention dentistry. We should remove least amount of natural tooth material. And as I said here, management begins with identification and elimination of disease. What does that mean? That means restoration will not prevent or eliminate disease. So what happens? You get a patient who has caries in a tooth, and you're a good dentist. What you do is you restore the tooth, you do a good filling, and send the patient home. After 1 month, the patient comes back, and he has caries in another tooth, and you again do a restoration and send him home. but he will come back with another carious lesion. Why? Because you are not treating the disease. You have to treat the disease, which is dental caries. And dental caries, as we all know, is a bacterial infection. It's a bacterial infection. It is caused by the bacteria. Unless and until you remove or lower the number of bacteria in the oral cavity, you cannot stop caries. You are not treating the disease. And what do these bacteria do? They produce acid, and that acid causes demineralization. The enamel loses its minerals. So there is demineralization, and you have incipient lesions, white discolorations, and you have to remineralize the tooth. See, you cannot prevent a disease by filling a tooth. For treating the disease called dental caries, you have to control the bacteria, and you have to remineralize the teeth. Understood? So these are the aims and objectives of minimal intervention dentistry. Treat the disease first. Surgical approach should be the last approach. Preserve as much as possible of the natural tooth. Manage with identification and elimination of the disease. Restoration will treat the disease, but it will not prevent or eliminate the disease. The disease can be eliminated only by, because bacteria cause dental caries, so you have to reduce the number of bacteria, and you have to demineralize teeth. Teeth which have demineralization have to be remineralized. So these are aims and objectives of minimal intervention dentistry. Did you understand this? Do you have any doubts or questions? Please ask me now if you have any doubts or questions about the aims and objectives of MID. Clear? Is it clear to everyone? Good. Clear. Good. Excellent. Now, what are the principles of minimal intervention dentistry? So how do we do minimal intervention dentistry? Number one, according to FDA, this is the World Federation of Dentistry, what are the principles? How do you do minimal intervention dentistry? So now see, minimal intervention dentistry means the least amount of invasion, the least amount of removal of healthy tissue. How can you stop caries? How can you prevent caries? So let us see what are the principles of minimal intervention dentistry. And then I will show you techniques. Right now, I'm telling you the principles of minimal intervention dentistry. Number one principle is modification of oral flora. If you want to prevent caries, you have to have good plaque control and reduce carbohydrate intake. Now, this carbohydrate intake means to reduce the sugars or refined carbohydrates which cause caries. So see how you treated the disease? You controlled plaque. Now, plaque, what does plaque contain? Plaque contains bacteria. These bacteria, when they work on carbohydrates, they produce acid. And this acid causes demineralization. And demineralization later becomes dental caries. So to treat the disease called dental caries, number one, plaque control. How do we do plaque control? By toothbrushing, by mouthwash, by dental floss. And how do you reduce carbohydrate intake? By reducing this number of sugars you are taking. Less of juices, less of sugars. So when you do this, you are treating the disease called caries by just brushing your teeth and reducing carbohydrates in your food. Refined carbohydrate, sugar. Another method of treating the disease called dental caries is patient education. Patient, simple, by talking. Just by talking, you are treating dental caries because you tell the patients about the causes, about the etiology of dental caries and the methods of prevention of dental caries just by talking. You tell them how to modify their diets. You tell them how to have good oral hygiene. So you just talked. And when you talked, you treated dental caries. Yes or no? Yes. So people know which food causes caries, which food does not cause caries, what is cariogenic diet, what is non-cariogenic diet, what are the methods of removing plaque, what are the methods for maintaining good oral hygiene, brushing, what are the brushing techniques, flossing. So this patient education is a method of treatment of dental caries. It's a minimal intervention technique. Just by talking, you prevented caries. So this is number 2. Number 3 is remineralization of non-cavitated lesions of enamel and dentine. Now, I hope you know this. There is something called as incipient lesion. An incipient lesion. What is an incipient lesion? An incipient lesion means a demineralized area, a white, opaque area you see on the enamel. This is the first stage of caries. And this is not visible when the tooth is wet. You have to dry the tooth. So when you dry the tooth, you see a white patch or a white line near the gingiva, a white, chalky white discoloration of the enamel. Now, this is called demineralization. This is a demineralized area. This is called incipient caries. This is called initial caries. This is the first stage of caries. This is non-cavitated. It doesn't have a cavity. It's not a cavity yet. This is called a non-cavitated lesion. It is the first stage of caries before the cavity is formed. After this, the enamel will break down and you will have a cavity. This is a non-cavitated demineralized area. So what is the treatment of a demineralized area? The treatment is remineralization. So how do we do remineralization? Now, the best method of remineralization is to do an oral prophylaxis and reduce the number of bacteria and the acidity of saliva. And saliva has minerals which will remineralize the enamel. So you use saliva, give me a minute, please. So you use saliva, so you use saliva to remineralize the enamel. So the next stage can be you can use fluorides to remineralize. But before using fluorides, use saliva. Reduce the number of bacteria in the saliva by a good oral prophylaxis. When you reduce the number of bacteria, it will reduce the acidity of the saliva. So saliva will remineralize the enamel automatically. So when we assess the saliva for quantity, for quality, it's very important to prevent demineralization, and it also helps in remineralization. So remember this, when we have a